Hi everyone, today is the 8th of December 2025. I have finally managed to get an appointment with my GP after the St. Thomas Hospital visit to get the referral for my MRI of the abdomen and pelvis. As you know, they have tried to delay it and send me to another GP for some reason, Oak Tree Medical. I don't know why, but let's go in and see what they say. Hi there, can you check me in for my appointment?
Date of birth?
17/01 99.
99. Name?
Shajul Rahman.
Miss Humaira Ashbach Rasul, please go to room 2.
You are already checking. Let me just check if the doctor is here or upstairs, yeah?
Got it.
Just take a seat here, they will call you.
Miss Gleed, please go to room 7.
Hi.
Charge your record.
Hi, have you received the letter from the GP at St. Thomas Hospital?
When were you seen at the hospital?
I think it was the 27th of November.
No, we've not received any letters.
Well, I
No.
went there. They said they have transferred me on to my GP, where
Yeah.
they found blood in my urine,
Okay.
doing a test there. And
Okay. Was that through the emergency department?
yes,
or?
AED triage. I called 111 because I've been having a lot of pains in my organs, right? And it's been an ongoing issue where I've told them many times what's going on and everything. For some reason, they're just playing games and keeping me in this vicious cycle, even after making police report, providing with all the evidence. And everything.
Police?
Yeah, police report.
Why
Because
was the police
my
involved?
medical records have been fabricated. I've also made a complaint at Loxford Polyclinic. They should have put this on my account, but for some reason I still can't see an email encounter on my account there. I did call them up last week when she booked me the appointment, and I told them make sure the GP is able to see the email encounter of my ongoing conditions and the complaint I've made. And after finding the blood in the urine, which I told the GP previously here as well, they said further investigations will be done with your GP. And for some reason they sent me to they booked me in for, so they did receive the letter and they booked me in to another GP, Oak Tree Medical, for some reason. So I don't understand.
So this is a problem that's been going on for years? How long have you had the blood in the urine for?
No, that started a couple of months ago, where it's been here and there. I did show proof and everything, and finally the GP, when they done a urine test, she acknowledged it and told me, she wrote the referral and said, you'll have to go back to your GP. I was expecting...
Was this on the 27th of November?
Correct.
Okay.
So the GP did receive the email here and everything, because they did book me in for Oak Tree. But I don't know, it was supposed to be done at Loxford, not Oak Tree, on a Saturday as well, when they're closed. So, and yeah.
So just to clarify, so you went into the emergency department
Correct.
at St Thomas's Hospital on the 27th. They checked your urine, and then she said that there was some blood in
Yes.
there. Okay, and then you were told that she was going to, or they were going to write to us.
They already did, because I was booked
Okay.
in. I don't know, you'll have to check the
Sometimes
reception.
it takes time to receive letters.
No,
Okay,
but
so this has been-
the GP has received it.
We probably have, but it's
Because
not.
you booked
not
me
been,
in
maybe
for-
it's not saved into the record.
That's what I'm saying. I did phone them
For
up on
November.
last week Friday, and I told them to put the complaint that I've made,
Okay.
so you can see my conditions.
Okay.
right. Because I've
So you were also under, in the past you've been under the urologists at Newham Hospital as well, regarding the blood.
they literally don't do nothing, and I've told them anytime they've done a blood test, it comes back as how they want it to be, right? And I've explained my ongoing issues with my organs. I've got loads of pain in both my kidneys, my liver, and they marked it as fatty liver, and yeah.
Did the scans show up anything concerning with the liver apart from fat?
This is why we need to get the scan done. They haven't.
You didn't have a scan? Where the fat in the liver would have been.
It's much
through
worse
the
than that.
scans.
It's just how they are putting it, fatty liver. So what I've done is I've provided you. You need to open up the complaint first, because I don't know why the receptionists have still not put it, because I called them on the 2nd, the 3rd.
There was also an
and the 4th.
MRI scan. Is that right? Was that done privately through yourself? In
That was
Hertfordshire?
months ago, right?
Okay.
And the radiologist there did detect lymph nodes, but then they had to change up the story and say they were never there, apparently, which again was my complaint with the fabricated medical records. So this is why it needs to be done with the NHS. And
So okay, so it looks like there have been issues going on for a good couple of months.
Correct. you need to pull up the email, because you will not know the severity
Email of what?
of the complaint I've made,
The
because I've
complaint that you
explained
made.
everything in detail.
When was that? When you sent that in?
It's on the email encounters. I've told the receptionist many times to put it on the email encounter so anyone can see it.
Do you remember when you sent it to us?
It was last week.
So again, so sometimes what happens is that it's probably been received and it's probably waiting to be scanned onto your records.
No, I've specifically told them. They send me an email back saying, we acknowledge your complaint, and
Yeah,
then
so I've
they
got
normally straight away they
Yeah.
put it up as email encounter, because there's a complaint. They
Yeah.
have avoided this after many conversations
Okay,
with
so
them.
I
So you'll have
haven't got
to-
access on your record, but what they have stated on the 3rd of December is that they have seen the email and they forwarded it to management to investigate it.
Sure.
So what are you hoping to get from today's consultation?
So you need to pull up the email from St. Thomas Hospital, because they sent me back here for further investigations,
Okay.
which means getting a scan done, which of the abdomen and pelvis,
Okay.
to see my organ health. And
did you say that you've had a scan through the urologist at Newham Hospital?
no,
They never did?
They haven't done any scans.
Okay. And would you be able to provide a urine sample today?
I will need to drink some water, because
Okay. So I'm going into the urology letters as well.
I'm happy to provide you with anything you need if you need a blood test today, right? But the main thing is scanning needs to be done, an MRI of the abdomen and pelvis, to put this on an NHS record, and you will see for yourself. because you know they're doing everything to avoid the main things, because you know what they're doing is fabricating my medical records and everything, which this is why you need to pull up the email of my complaint so you can understand the issue.
Yeah, I don't have that. That's been part.
That's
Sometimes we
something-
don't put it into the record because it's a clinical area, but they do file it away with all the complaints. So that's with the manager. So you did have a scan. So I've got a letter here dating back to June under Newham Hospital, and it states here, the consultant's letter: I have reviewed the ultrasound scan of the kidneys and bladder, and that's come back as no concern. So
I did not have an
regarding to those,
ultrasound.
which
I
is
only
good
had a blood
news.
test. I only had a blood test with them.
So I could try to access the ultrasound scan.
I think, yeah, I had a scan
Ultrasound
afterwards,
scan.
not that the same day, and yeah, that was the fabricated one, which I've also documented.
What makes you think it's fabricated?
I don't. What makes you think? It's not me making it think. I've made a police report and everything.
What's the proof? How have you provided
I've-
evidence to say that it's fabricated? And why would a medical professional fabricate it?
This is the thing. They're trying to cover up my true conditions
Why
because
would
I've
they
managed
cover
to expose medical fabrication.
Why would they want to?
This is the thing. It's
close?
like,
Which is because it's in our professional guidelines.
unfortunately, they have targeted me for, you know, for some reason, and yeah, again, if I explain it to
But
you, you will not understand
you know
it.
that the consultant doesn't scan; it's the radiologist. So do you trust the radiographers who've scanned you?
No. So how medical fabrication works is the machine itself gets compromised, meaning the ultrasound machine is running on a network. It can be done to CT, MRI. Any of these machines can get compromised, and the screen will show you what you need to see. Right?
Okay.
So
So
this
how?
is-
So if I was to request another scan today, how do we know that that hasn't become fabricated?
Because I've made a police report and I provided the police report.
How are they going to prevent a fabrication? How? So if you would, if I was to refer you for an ultrasound today, and you went to the
Ultrasound will
appointment,
not work because of the blood in the urine, finding the lymph nodes.
So you had the ultrasound scanned in May
I do not.
2025,
I do not want an ultrasound. I want an MRI because of.
and you don't believe the MRI scan that you had
MRI
back in
will-
March? You had an MRI then as well.
I've done things privately, and the radiologist did find lymph nodes, and then because someone is there's a whole fabrication team behind it just to cover up my true conditions and not let this come out publicly in the media, because you know I've been documenting my whole journey. I've got the evidence. I've done everything. I've got the police report here with me anyway. But again, it's something that you know won't matter to you, because you need to go by what the St. Thomas
Let me just
Hospital
ask you
has
a few more
advised as well.
questions. Have you got any pain when you pass urine?
Yes,
There's always some pain, yeah.
yes.
And
It's like a stinging
whereabouts in the tip of the penis?
Yeah, penile pain. I've explained this
In
before.
the shaft as well?
Yeah.
Okay. And you always see blood in the urine?
No, not
Just
always. It's
sometimes.
episodes here and there.
Okay. And that's been going on for a few months?
The GP at St. Thomas did explain to me if it was an infection, it would have smelled bad, but it's
Are you passing urine very often, do you find?
no.
And not night either, yeah? You're not waking up in the middle of the night passing urine so many times?
Yeah, sometimes.
How many times?
Once.
Is that normal for you though?
Yeah, it's become normal. It's because of my conditions. It's becoming worse and worse. And I've got constant pain all over here and the back, which again is the.
So it starts on the right side of your back going
No,
into
it's both sides.
both sides.
It's here, and
Okay.
yeah, this is what I've lived with, and my body has just gotten used to it because you know, like I
Okay.
said,
And is that pain made worse with anything you do?
like I said, I'm unable to do. I'm even unable to walk properly now, which I've explained. You know, I have to hold my back when I'm walking because I get that sharp pain, and
Okay.
yeah, it's just that big conspiracy of covering up the medical fabrication and not let this get out.
Okay. And any tummy pain, abdominal pain
Sometime I'll get like a
in the lower bit of
yeah.
your tummy. Okay. Fine. Okay. Would you be happy for me to examine the back
Yeah,
and
sure.
the tummy? And any other medical issues?
No. I've been throwing up recently, and which that's why I basically, because I thought I would have to go to emergency because of the pain I was having and everything. So, you know, I had to see 111 and everything.
Hang on, I'm just going to have a look at the back to start with, and then point with your finger. Where do you feel the pain? Around
Back.
there, yeah? Okay,
Yeah.
so middle is fine. The middle is fine. You can let go.
Yeah.
So middle is okay. It's not tender. That's not tender, yeah?
Yeah, no, it's
Okay.
fine.
And then, so it's around here.
Both sides, and it goes up to here as well.
So would you say around here? All around here?
No, a bit lower.
A bit lower, yeah?
Yeah.
Okay. When I press in there, any pain?
Yeah.
In here as well?
Yeah.
Okay. And can you bend your knee straight?
I mean,
I'm going to just keep this up.
I won't be able to go too low,
Why is that?
but because, like I said, I've been having pain. And
Okay.
I'll
Is it
find
more painful when you bend?
No, I can bend, but like I won't be able to go too low.
Why is that?
It's because of the pain.
Because of the pain.
Yeah.
So pain stopping
Like,
you from
yeah.
using the muscles
Exactly.
to bend forward. Okay. And then if you lie down flat on your back. Okay. Sorry. And then do you mind if I just have a quick feel of the tummy, especially on the lower side? So as I press, just tell me if that feels tender. That's all okay? Yeah. Sorry, I'm just going right here. Any tenderness when I press? This is okay?
I've got pain.
There's a bit there. Okay. And you're not constipated? No change in bowels? Okay, that's fine.
So they marked one of my kidneys as having a kidney cyst,
Yeah.
and then which changed into having a hemorrhage inside that cyst,
Okay.
and that was one of the excuses.
And then if I just have your wrist, should be sufficient just to get your blood pressure reading. And just keep that still. Can I give you a bottle? So although you're unable to pass urine now, would you be able to give a sample and then you can drop it off?
Yeah, sure. I mean, if you're doing a proper urine test,
Yeah.
not just a dip test.
No,
dip
no, no,
test.
no. This is a proper one. This will
Exactly.
go to the lab, yeah? So it will also confirm if you've got bits of blood in there that we can't see. Yeah? Let's have a look. On the form, you've got your NHS number there as well, so you just make sure you put your name, date of birth, NHS number,
Sure.
and the date of the sample. Okay. And I'm sure you've had blood tests done as well in the past for your kidneys. Nothing came up.
This is what I'm
You've
saying.
had one in,
I've put them up for investigation because they've been playing games with my medical records. This is why.
And who do you say is playing games with the medical
Again,
records?
it will be, like I said, it's a very big conspiracy because they don't want me to.
When you say who are they?
I can't explain. Like it will be the government because again, these institutions are controlled by them, and.
Okay. So is it that you're not concerned about the surgery or the consultant, the urologist? Do you think it's the government who's sort of indirectly?
Again, for you will only go by what you see on your screen, right?
Mm-hmm.
Meaning, I give you this urine test, it will come back how they want you to see it, right? The blood test, how they want you to see it, right? This is why what needs to be done is right scanning, MRI of the abdomen and pelvis, which I've reported to the police. That needs to be done. I've made a complaint to the clinic. This is what I'm expecting, and I've given them a police reference number, the police report, and everything. So once this is done, then on the record that the people behind it, they are the ones that'll be behind it if they do not stop it from getting compromised.
And who are the people behind it? It's the government.
I mean, it will be the government because again, they wouldn't want medical fabrication to come out
requesting an MRI
publicly.
scan? So even if you were to have whatever tests done, how do you know the government won't be able to?
So let's say,
that?
let me give you an example so you can understand it a bit better, because that's something you have never come across and a lot of people haven't. So let's say it's COVID time. Once again, we're hit with a new wave of COVID. They can literally target any individuals they want, right? This is how they maintain their control and everything. And I've been the only one that's been blessed enough to keep up, documenting my journey and stayed alive long enough to expose it as well, which I'm going to share eventually with Loxford Polyclinic. But for now, I'm doing everything I can to bring this to the attention of the clinic with finally making a report, because it's all clear on my medical history on my NHS account what they're doing with my blood tests, Sherry Govinder.
So I've heard all of that, but what I'm saying is, how do you know this urine sample, for example, isn't going to be fabricated at the lab?
I mean,
or a request for an MRI scan? How do you know that the report isn't going to be fabricated?
Oh, because with the MRI scan, right, it comes with proper imaging. And what I do, I request that imaging from the NHS.
So there is a difference between different scans. So some scans actually, you see certain things better than other scans. So we always try to target the right scan for the right problem. So for example, if we're worried about kidney stones, then most likely they'll be picked up on a CT scan rather than
That's
an
incorrect,
MRI
because
scan.
CT scan can be done like this, right? And whoever's compromised the computer, right? Because it just takes an image, right? With the MRI, it takes. This is why last time I done an MRI,
but then
lymphs was spotted by the radiologist.
But you don't believe your own MRI scan that was done?
Because it's incorrect. It's fabricated. So
but
the radiologist.
But how do you know that future MRI scans won't be fabricated either?
It doesn't matter to me if they are or if they're not, because I've done it on the NHS system. Then it goes back to the government and my police report and the connections being made.
So I think what I'm going to do, what I will do, because it's quite complicating and it's quite a complex issue, and there have been lots of tests done, but there is an issue about fabrication. What I'll do is I'm going to discuss this with my fellow colleagues about the right way forward in terms of the scanning, and then I'll get back to you.
I've already made the request. This is why I told them that it needs to be on my account for you to see it, because there's no point me coming here and then coming here again.
So I will be speaking to the management and the manager.
Is that going to happen now, or is that going to?
No, because I'm seeing patients at the moment, so but I'm going to be discussing with them. So
because the only thing I'm here for is for the referral, because I've already done the urine test, right? I've done it at St. Thomas. She's done the dipstick, found the blood, and now for some reason when I come here to you, right, you can't see the report that's been sent by St. Thomas. You cannot see my email.
It takes time.
I mean, this is what I'm saying. It's creating confusion for everyone.
Yeah.
For me, I do not have enough time, right? I'm in pain. I've requested 111. Either the only thing you need to do is give me the referral for the MRI of the abdomen and pelvis, so I can go and get this done, because it's just literally is, I've hit the breaking point now,
Mm.
right? For some reason, when the report is hitting you from St. Thomas, you're sending me to a GP that I don't have a clue about, Oak Tree Medical, on a Saturday when it's closed, right?
My only concern is that, you know, if we feel that you go for an MRI scan, we get a report back and it comes back as everything is okay, is that going to then resolve everything? Because the feeling is that whatever scan or imaging you do, there's going to be some degree of fabrication. So it's not really going
No,
to,
why should
you
there
know,
be fabrication? Like I said,
Mm.
it will be on the NHS system. This is the whole reason it has to be done by the NHS. Because I've
Okay.
made the police report, I've done
Yeah.
everything documenting it. So if there is any
Yeah.
fabrication, that means the whole NHS systems are compromised. And this is
Okay.
where it puts them
But the
at
thing is,
the
you
news,
see, you know,
news
I
level,
can,
where BBC
Mm.
and the news channels will have to cover it. Because if it happens to your parents, your mother, your father,
Mm.
right, that means they are sending everyone towards death. Again, COVID hits, they're just gonna declare you dead.
you know, I mean, I'm just trying to point out to you that if you go and research yourself,
Mm-hmm.
an MRI isn't going to necessarily rule out a kidney stone. So if you're going for an,
No,
if
I
you're going to go
don't
for
have
an
kidney
image,
stones. I have organ failure. I'm going through organ failure, and this is what I've explained. I've got pain all
okay.
around.
So you're requesting
Blood
for
and
an
urine is there, right?
Okay.
I've told you about last time I done an MRI. Radiologist
Okay.
did find lymph nodes.
Leave that with me. What I'm going to do is I will discuss it with my colleagues today, and then we will get back to you. Yeah.
I mean, are you going to? Because again, there's no point me coming
So
back
we
here
have
because that's
we
that's
have
the
a
whole point I'm
clinical
here.
we have clinical meetings on Tuesdays where we discuss our patients and decide on what would be the right way to go. So I'm going to discuss it with my colleagues because of the complexity of the issues here, and then we will get back to you. Yeah.
But this is the thing. I've already emailed them the complaint. I don't know why they have.
I've not got
shared it with you.
exposure to that, so outside of
I
my
mean, for
clinic
me,
time,
this
I
is
would
what
have
I
to go
feel-
to the manager
feel
and
like
have a word.
Loxford
yeah?
Polyclinic is, you know, the staff there is just playing games, like sending me back and forth.
Yeah.
They are also becoming part of this conspiracy because I've told them many times. I've called them multiple times to document this and leave it on my record because it needs to be known. So just like you have seen me here as a GP, I go to Oak Tree. They're gonna tell me the same thing. I don't know this. I don't know that.
No, we're
I
not
don't
saying
even
we
the
don't
report
know.
that you made,
I'm going to
and then-
discuss it with our clinical colleagues, and I think that, you know, you must have got a response for the complaint that you've put into us.
I haven't. I only received the email saying we have acknowledged your complaint, and that's
Yeah.
it.
Yep.
For
Okay.
the-
And have
the
they
rest-
given you a time reference for how soon you will be contacted regarding
45
that?
days. Do you think I have 45 days to stay in
Was
this
it-
pain?
Okay, so
St-
I will.
stay
I'm
throwing
going
up?
to discuss it with my colleagues and with the manager and get access to the complaint.
And it's not me
and then come back to you. Is that
exaggerating,
okay,
right?
yeah?
If someone,
know.
if for me, I went to St. Thomas for a reason, meaning the Parliament is there,
Yeah,
right?
I understand.
And opposite it, I went there to get scanning done, imaging done. She acknowledged the blood, but for some reason said, you know, we cannot do any tests here, and you need to
Yes.
go back to your GP. And I waited
Yeah.
2 weeks for this appointment now.
Yeah.
So since the 27th, nearly 2 weeks, just to wait for this because they have been throwing me around. They can't book
Yeah.
me in.
I
For
understand.
some reason, it's
I'm
Oak
going
Tree.
to have to speak to my colleagues and then give you a call tomorrow, okay? Because we have our clinical meetings and we discuss patients. So I will call
That's
you
fine.
tomorrow.
As
with an
long as you
outcome, yeah?
understand me.
I
and
understand you, and I've documented
what-
everything that you've said.
There's, I do not want you to come back and say, you know what, we will send you to an ultrasound only, because what I need is an MRI for the abdomen and pelvis, which will be clear on the once the imaging is done, right? I've made the police report. I will go to the police station. I will notify them that, you know, this is the appointment date. I mean, that's their job to do anyway. And this is what you need to stop from the machines or anything to be getting compromised, and give me, so I can,
Okay.
because I haven't been
I
able
think
to
I
move
will
on
have
with
to
my
end
life.
because I'm really running late, and I've got
This is what I'm saying.
patients,
It wastes a lot of time. We've got a
who
lot
are
of
waiting
patients.
there. I've got young patients and elderly patients, if you don't mind. I've taken fully on board everything that you said,
Mm-hmm.
and as I said, I'm going to discuss it in our clinical meeting with all the other doctors there present, and then we will come back to you.
Sure,
okay,
I've
on what
already
was
mentioned it in my
discussed. Is that
email
okay?
anyway, so it will make it easy for you to explain it to them.
Sure.
I've told
Okay.
them all the made up
I think we'll
conditions
leave
they
it
have
at
told
that,
me.
please. Yeah?
that's fine.
Okay. All right. Thank you, Sandy.
Hi, who am I speaking to?
My name is Sukhinder. Who am I speaking to?
You speaking to Shajul.
Yeah, how can I help you?
Hi, can you put my can I speak to your supervisor?
Sorry?
Can I speak to your supervisor?
What is it regarding, sir?
It's regarding my issue that I've been having.
What can I take your date of birth?
Yes, 17
Okay.
01
Okay.
99.
And what's your name, please?
Shajul Rahman.
Okay. Let me go and look for them. Is it regarding something to do with your issues?
Yes.
Okay. Let me get him to you. Hold on.
Hello.
Hi there, who am I speaking to?
Hi, my name's Umran. I'm one of the senior admins here. How can I help you?
Hi there. I came in yesterday. I had an appointment,
Yeah.
right? After nearly 2 weeks, they managed to put me in for an appointment yesterday, right?
Okay.
And that's because they were trying to send me to a different GP after I've been to St. Thomas Hospital and they found blood in urine, right?
Okay.
They booked me into Oak Tree Medical for some reason. And after nearly 2 weeks, I've managed to get an appointment
Okay.
yesterday, and they did not. I was told I'm going to get a call today to get my referral for the MRI of the abdomen and pelvis.
I see. Okay. Okay.
Right. I've not received any call back. I've not heard back. I'm just checking if you have that referral.
Um, was it the doctor you spoke to yesterday that said they'll call you back today by any chance?
Yes.
Okay.
I mean, it's 3 p.m. now. It's
Yeah, Dr. Vij said that they'll call you. I can message her and find out if she can give you a call and say that you call and you're expecting a call from her. Would
no.
that be okay for you?
All I need is a referral, right?
Yes. Yes.
What is
So
it? So also, right? The confusion is I've told your team many times. I called 3 different days. I've called your team. I was told that my email encounters, the complaint I've made, right?
yeah.
The email received from St. Thomas Hospital should be logged in my documents, so I can see it on my
Okay.
app, and the GP can see it on their on their system as well. But that complaint is not logged. The letter from St. Thomas Hospital is not on my documents, right? And it's created a whole confusion where I came in for nothing because the doctor is confused on what's going on. She's not able to help me as I expected, right? Because look, they have not still not provided the MRI of the abdomen and pelvis, even after all the
I see.
symptoms, which should have been done, just
Yeah.
because the documents were not logged from your end, right? So I'm gonna give you the email that I've sent you. If you can put it on my, if you can add it on my account so I can
Record.
see
Yeah.
it, right? As
Okay.
because look, any email I send comes as an email encounter added on 20th November, but this specific complaint, the email from St. Thomas Hospital, has not
Yeah.
been logged. And yeah, just before I met the GP, even she was confused on what's going on, right? And she has not been
Okay.
able to provide me with the MRI referral, which should have been straightforward. And now
Yeah.
I'm having to call back again and again and again, and it's creating that it's confused. Your whole team is confusing everyone
I see what you
just
mean.
because that was
Okay.
not done. But if, like I said, the issue is very serious. I've came in yesterday. I've told everything, and it's having to repeat myself over and over and again. Again, these calls are
I do
recorded.
apologize. Yeah.
You can go back and you can listen to them all. Where I've mentioned multiple times. Last week I spoke to Simpson Renell, right?
Who is it?
Renell Simpson.
All right. She's one of our new members. She just joined 2 weeks
Okay,
ago.
no,
Yeah.
I spoke to someone senior last week on Friday, I think it was, and on she's the one that managed to book me in for Monday, and
Okay.
she's the one that said, that document will be on my account because it's a complaint, right? It explains everything that's going on. and this MRI of the abdomen and pelvis referral should be just straightforward, right?
I see.
So
Okay.
can you put my email in on the system so you can see which one I'm talking about, so you are aware.
1 second. Let me see how we.
I'll tell you the
Sorry,
email
because
that I've received it from. I'll
I'm
send
on
it to you.
my colleague's computer at the moment. I don't know if she's got access on her computer. I do have it on my computer. So are you able to send that email again and I can action it? And you should be able to see it on your account today.
Me sending that email again.
Yeah, because you mentioned it before. Because then it'll come to the top, so we can't miss it, and I can add it in straight away. Would that be okay? If you just
Yeah,
forward it
yeah,
again to us.
I'll do that. But again,
Perfect.
what I need from you is the
Yeah.
MRI for the abdomen, referral for the
The
MRI of the
referral.
urgent. Like I said,
Yeah.
I've called NHS 111. You can see on my documents, NHS 11
Yeah.
report received. And again, after so on the 27th of November, they found blood and urine at St. Thomas Hospital. They said,
Yeah.
unfortunately, they can't do any more scanning there or
Yeah.
any more investigation. What I need to do is go back to my GP. So
Yeah.
came back to my GP, right? And they tried to send me to Oak Tree Medical for some reason, right? And now that wasted a lot of time,
Yeah.
nearly 2 weeks. And now I'm having to do this all over again, having to send an email, do this, blah, 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 which it should be done from your end straight away instead of, creating the confusion.
Yeah, again, I do apologize about that, but that's fine. Leave it with me. What I'm going to do is I'm going to put that email first thing onto your record, and then I'll speak to Dr.
I'm
Vidge,
gonna
who you
send you
spoke to yesterday.
the email right
Yeah,
now so you can add it
perfect.
as an
Yeah,
email encounter, and then you can
no
know
worries.
the situation because,
Yeah,
like I said,
and I'll message Dr. Vidge now to see if she can give you a call, get that referral sorted out for you, and any other queries she can resolve for you. Is that okay?
sure.
Perfect, no worries. That's
So
fine. If there's
what's
anything
your
else,
name?
just give us Imran. Imran.
Imran. I'm gonna send the email now.
Yeah. Yeah, perfect, no worries. If there's anything else, just give us a call. Ask for me. I'll speak to you directly. I'm more than happy to deal with it between me and you, and I can sort it from
Like
there.
I
Is that
said,
okay?
all I need is the
Referral?
referral so I can move on and
Yep.
get this done. So once we have the imaging, right, you can
Yep.
know we can get to the bottom
What the
of
situation was. Yeah.
exactly that simple as
Okay.
that. I mean, you can't gatekeep this. You cannot hold everyone back just because the
Yeah.
doctor decides. It's ridiculous.
I do apologize. Yeah, no worries. That's fine. Leave it with me. I'll get that sorted for you now.
Thank you, man.
No worries. Thank you for your time. Take care now. Thanks. Bye.
Bye. Hi there, you okay?
Hello, sorry, are you recording the call?
Yes.
I'm so sorry, we're not allowed to be on call if you're recording it.
I mean, it's going to be recorded on your end anyway, and I do this for my safety because, again, every time I've spoken to your team members, they have told me one thing and been doing the other thing. I mean, they're just playing psychological games, which has affected my health, and yeah, so it's important for me to document this.
Okay, I'm really sorry, just because we were told not to, what I'm have to do is unfortunately hang up the call and just get
I mean,
management to speak to you.
I spoke to your supervisor the other day, and she was completely fine with it.
Sorry?
I spoke to your supervisor the other day, and she was completely fine with
Hello?
it. Can you hear me?
Hello? Hello?
Yes, can you hear me?
Hello? Hello?
Hi.
Sorry, the line cut out there. I didn't catch what you're saying at the end, sorry.
Yeah, no, can you hear me now?
I can hear you now, yes, sorry.
Yes, I spoke to your supervisor, and she has been completely fine with it.
Which supervisor did you speak to, sorry?
I can't remember the name. It was someone last week on Friday, and again, I have to do this because of what your team has been doing consistently.
Okay,
Like it's.
I'm really sorry about that. Okay, I'll flag up with management and just find out what's sort of going on, and we'll see how we move from there. Is that okay?
Have you received my email?
Yeah, I'm gonna have to hang up the call. Sorry, I'll call you back with management. Okay, thank you.
Hello, good afternoon, Loxford Practice. How can I help?
Hi there. Who am I speaking to?
Shashi.
Hi. Is Imran around?
Sorry?
Imran.
Yes. Oh,
Yes.
you want to speak to him? No, he's gone home.
Sure.
Finished his
I
shift.
was told I'm gonna get a call back, but no one has called me back yet. And
Mhm.
I was supposed to get the referral for the MRI of the abdomen and pelvis today. And I've sent the email once again explaining everything, and still no one has contacted me back.
I can't hear you properly. Let me just call you back. Hold on.
Can you hear me?
Yeah.
Hi. I was told I'm gonna
Was
get
it? Yeah. Okay.
Can you hear me?
Yeah, I can hear you. Yeah. Can I have your date of birth, sir, so I can check exactly what's happened? What's up?
Sure. 17/01/99.
Okay. And your name?
Shajul Rahman.
Okay. Yes. So how can I help you, sir?
Hi. Have you received the email that I've just sent? Because I was told by Imran to resend the email, right?
Mhm.
And they will put it on my NHS account as an email
Okay.
encounter, which has still
Mhm.
not been done after contacting you many times.
Mhm. Okay. Let me have a look. Oh yes, this was the I remember this email. It was a complaint, wasn't it?
Correct, but that still hasn't been logged on my account as an email encounter. And when I saw the GP yesterday, right,
Mhm.
she had no clue, and she did not even receive the letter from the St. Thomas Hospital, right, where they found the blood in the urine and told me to go back to the GP for further investigations, meaning the MRI
Mhm.
of the abdomen and pelvis, right?
Mhm.
And I was told today I will get a call to get that resolved, meaning to get the
Mhm.
referral for the urgent referral for the MRI of the abdomen and pelvis, and
Mhm.
that still has not been done, meaning they are just doing the same torture over and over again, meaning I have to continuously call back to get this on the system, right, which should be done from your admin team,
Mhm.
meaning just like every other email trial, like like everything you put it as an email encounter, but for some reason the complaint you have not put it, the St. Thomas Hospital letter that you have not attached. So the GP and everyone is like it's used as an excuse that this is why the GP is clueless,
Mhm.
right? And they did not do the right thing to send me for
Okay,
the.
what did Imran suggest you to do?
He said he told me to email the complaint once again, which I did. So if
Mhm.
you, so it's
Mhm.
on top of your inbox, right? And I've also mentioned what happened yesterday when I met the GP
Mhm.
and what
Mhm.
needs to be done. Meaning you already have
Mhm.
received it. It will be urgent. Receive from. I looked that up.
Mhm. Yeah, no, I remember this, and I
No, I've
forwarded
sent
the
a new
whole
one
one.
and I've added what happened yesterday and what needs to be
Yeah, the
done.
thing is, the urgent emails. I mean, the emails. I'm not able to open it up because I don't have access to it. But Imran, because he's finished for the day, he should have made a note of it, and he will call you back tomorrow for
I
this
was told I'm
reason.
going to get a call back today and then I have to wait for tomorrow once again, and it's going back and forth
What I
until
can
you
do
make the
is
patient go crazy.
no. You won't. It won't happen like that. What I can do is I can send a message to him now, saying that you did call back, and he can action this the first thing in the morning and give you a call back. Okay?
But what's going on with the referral? Why did the GP not call me back today? Because that was her job to do.
Yeah. With that, he will have to follow that in because I can't follow that for you. But I can, since he was dealing with you, I can. I don't know what he has done with this matter. So I have to tell him to call you back, sir. Okay?
At 4 p.m., I
Uh,
was told that, the admin team, the senior managers will call me back. At 4 p.m., I was told this today.
okay. Just give me a moment. Okay? Hold on. Hi, I just did follow back on it. He has called you. My colleague did call you, but you started recording the call, so he couldn't give you any more details because of that.
What does that have to do with
Nope.
anything? Meaning that the reason I record the call is because
Mhm.
everyone at the practice, whenever I call, they're playing dirty tricks. Meaning they are not recording the consultations properly. Meaning when you're typing in,
Well,
you're
so
not
that's
adding the
what.
details. You're
No,
not
okay.
doing what you're supposed to do. This is why
I
there's
do.
policies and procedures. So if anyone
I
is
do value
compromised
your
or consumed,
feedback. Yeah,
this is what you
I
have to
do.
go by. You have to go by the law, and then if I'm recording the call, it's for my own safety, right? These calls
Yeah.
are recorded from your end, right? You can go back to your IT team and listen back to everything that I've discussed, how many times I've called back, and the things I've mentioned. And from my end, your admin teams have been playing dirty tricks all around, just keeping me, going insane. Like everything's on your record. right? You're not logging in the consultation. So if I got right, I think I spoke to you a couple of times last week, right? That was not logged on the consultations, right? And then me seeing the GP yesterday was no point because she was not given the right details. She was not told about the St. Thomas Hospital letter. She was not told about the complaint I've made and the request of you know the normal procedure. Once you find blood in the urine, my symptoms, the renal and like kidney cysts that turn into the
I
hemorrhage and all
after
the
you spoke
excuses.
to me, I did raise the email, the matter of urgency, and I did speak to one of my senior admins to chase it up. And today, what Imran had done was she tried to call you back in relevance to what you asked today, but because you started recording, the only thing is if there is an issue with our service or what I see from what you're saying is there's an issue with how we deal with your queries, then you would have to speak to the top management. And I did send a message off to him, and he did reply. Imran did reply, and he said that he will have to pass this on to the top management for them to give you a call, and you can speak directly to them. Okay.
So if I'm recording the call, that is for my safety, and right, I'm not because I'm not getting
But
the right sort of again, what your team is doing is completely wrong. If the calls are being
yeah, for
recorded,
you to
and for me, I can do this silent recording on another phone, right? But me, I press the call recording button, so you're aware that these calls are being recorded, and everyone must do their job accordingly,
yeah. But,
right?
no, I do understand. For you to record the call, that is your safety. I do understand that. But if for you to record that call, there has to be a real problem. So that has to be raised to the top management. My colleague, my senior admin, will raise this to the management tomorrow morning, and you will definitely get a call back from them. Okay? I do trust that. I just spoke with him right now.
So you
All
can't
right.
share what Imran wanted to say to me.
No, I can't. He hasn't shared it with me anyways to tell you because he's tried to speak to you directly, but because of this issue, he wants
No,
to.
he told me the senior manager is going to give me a call back. So because he told me, oh, sir, you can't record the call, and now I'm going to get my senior manager to give you a call, and no one has called me back.
Yeah, not today, sir, because it was at 4 o'clock. No, there's no top management, senior management working at this moment. So it will be tomorrow morning that you're going to get the call back, and I do trust that they would call you back. Because it's not just one problem that you're escalating. You have many problems, which I did see from the email, and I did raise urgency. I don't know why it's not been actioned, but tomorrow, since you're going to be dealt with the top management, there will be some kind of a
You
an
see how
answer.
much time
Okay.
that has
Yeah,
wasted
I
because
do.
again, I just to see a GP, right? They were trying sending me to another GP. I had to wait 30
Yeah.
minutes for my appointment, right? And then it takes the GP is clueless about what's going on because no one has added the right documents, the email request, the St. Thomas letter. So again, it's created. The only thing I need from
No,
you
I do
guys is a
understand.
referral,
Yeah, yeah.
urgent referral for the MRI of the abdomen and pelvis. Once the scanning is done, that's it. That's it. We can all move on. But why are you
All right.
gatekeeping a scan?
There must be a reason. There must be a
They might
reason why
because they're
the
hiding the
referral.
truth about what they have been doing and of my true conditions. So that means everyone's
Yeah.
part of this conspiracy, and this is why I had to record. What I also want you guys to contact the police and just say, we have this patient.
I mean, you can
He's
speak with the
done
top
this.
management tomorrow, and they can do what's necessary for you, sir. So I think that you will get a call back tomorrow, and just speak with them because there is no other place to escalate
Because I was
this
told I was going to get a
problem.
call back today, and then this is why, and I'll have to wait till tomorrow, and then
All right.
the same thing.
Okay. Yeah. So apologize for that because they do leave around 4:30. I apologize for that information, but tomorrow just have a look because they will. I did call him myself, and he did say that tomorrow he will be in contact with the top management. I know you might be recording this call as well, but that's for your sake. That's totally up to you. But tomorrow you'll get a call back from the top management. Yes. Okay.
That's fine. Can you add it on my consultations that I spoke to you
Yeah. Yeah.
at this time? And
Yes.
you have said that I will get a call back tomorrow to speak to senior managers and discuss my issue.
I can't add that to the consultation, but you can call in the morning and mention my name, okay? Do you know my name?
No,
Shashi.
Shashi.
Okay? Yeah?
That's fine. But add whatever you can that I did speak to you, and
Yeah, sure,
what's
that's
going on,
fine.
because
Yeah, I know you're in an urgency to get your
I
MRI, and
shouldn't
I
be
do
having to do
understand.
this. I shouldn't be having to. It's a
Yeah, no,
waste of your time. It wastes my time.
yeah,
It's
yeah,
going
because
around.
yeah, to be honest, I just joined 2 weeks ago, and you have been calling for a few of my colleagues, and it's gone back and forth. But I actually don't know what the original problem was. And when I looked at email, there has been more than one problem, right? So
Exactly. It's a detailed email,
the
and
top,
we should just get it
yeah,
over and done with. Meaning,
yeah.
you send me
So
for
the
an
top
MRI referral,
management,
for the
yeah,
abdomen pill, and that's it. Done.
yeah. The top management has to go through each one of them to see how these problems have arisen, and I think they will help you more than anyone else.
That's fine. We'll
Okay.
leave it there, I guess.
All right. All
Thank you,
right.
Shashi.
Take care then. No
Cheers. Bye.
problem. Okay. Bye bye.
Good morning, Loxford Practice.
Hi there. Who am I speaking to?
My name is Magdalena. How can I help, sir?
Hi there. I need to speak to your supervisor. Is anyone there, Imran?
Yes, who's looking for him?
Um, just tell him it's Sharjil calling regarding his case.
Okay, bear with me 1 second.
Hello.
Hi there. Am I speaking to
Hello.
Imran?
Sorry.
Am I speaking to Imran?
Correct. Yes.
Hi, I spoke to you yesterday regarding my complaint,
Correct.
and the I still cannot see the email encounter on my NHS account, and and waiting for you to tell me what's next.
That's fine. I did flag up. I did call you back to give an update, but you did end up recording the call, and I'm just wondering, are you recording the call now as well?
All my calls are monitored and recorded,
That's
not just
totally
by
fine.
me,
So
just
no,
by
no,
your end
I
as well.
understand that. No, I know. But if you're recording the call, we need to let management speak to you in that regard.
And I spoke to the management earlier, and they were completely fine with it.
Which management did you speak to?
Someone last
Which
week,
member?
whoever said, they're gonna put the file on report, and then it's that same vicious cycle. I've also explained it in my email.
Did you
Did you
grab the
receive
name
my
by
email?
any chance
I
of the
can't remember the name.
management
It was
person?
Renell Simpson or something.
That's not a management person. Sorry. What I'm gonna do, I'm gonna have to hang up unfortunately, and what I'll do is get Asmo to see if he can give you a quick call and speak to you. Is that okay?
What's the point in hanging up if have you received my email?
I'll let Asmo deal with it from here. Okay? Thank you.
Can you get someone from admin to call me? Hi Shashi, it's me again.
Is it Shaj? Mr.
Yeah,
Shaj, yeah?
that's it.
Yeah.
I have to do this, right? I spoke to you yesterday, right? And I called back
Yeah.
today, and no one has contacted me, right? No one has updated my records, right? I was told senior managers are gonna give me a call to resolve this,
Yeah.
and
Did
now
they not give you a call?
no. Is
Okay.
there
Just
anyone
give me one
available?
moment. Yeah, I think he is still here. Just let me.
Who?
Just give
Who
me
is?
Umran, the one
No,
that
no, no.
was.
I don't want to speak to him. He has this morning when I called him,
Mhm.
he's not comfortable of me recording the call, and he's the one that's been telling me, senior managers will give me a call. So I need someone senior than him to
Okay.
get
Just
on the
give me
call
a
right
moment.
now.
I'll just have a look. Okay. Hold on. Hi, sir. Thank you for holding the line. So I did speak with the top management.
Yep.
They're not here today now at this time, but you are definitely going to get a call back tomorrow. Okay.
And you said that yesterday, the day
I mean,
before.
did you not speak in the call? Are you not able to call in the morning
I
when you
did. I
will
did
get
call
one?
back. I did call
Okay.
you. I did remind him, and he
Mhm.
hung up on me. So this is.
Was it
I'm
Umran?
gonna put in another complaint because patients in the UK are legally allowed to record phone calls for their own records, right?
Mhm.
Hanging up on a patient, especially one repeatedly requesting urgent care, is a serious breach of your professional standards and duty of care. So you keep telling me that if you cannot do what's necessary, which is the MRI of the abdomen pelvis. I mean, hanging up is one thing. You have not even added what I've asked you on my record, so I can go to A&E, right? And
Mhm.
me continuously calling back and you saying we'll call you tomorrow. How many days have you done that, Shashi? Come on.
Okay, the problem is I have told I have to escalate it to the senior manager, right? The senior admin, who's Umran. Umran has dealt with you, but you're not happy with him dealing with you, right?
No, he hasn't dealt with me. He's hung up the call, right?
Mm-hmm.
And because he thinks
I'm just
it's
a receptionist. I can just pass through the messages to the top management. I myself, which I shouldn't have done, I went to the top management now, and I asked them, and they they have their certain times that they're going home and blah blah blah. But without regards to that, I asked them, and they said they'll definitely give a call tomorrow. That's all I can do. The best capacity I can do from my side is to actually escalate it to my seniors, which I have done.
yes,
Okay.
but again, as a clinic, you have not added my
Yeah, it has been added here.
no, it hasn't. I can see
Yeah.
on my NHS, right? I open up my NHS account right now.
No, not the
So
NHS account. We have our own consultation record within the GP, and it's that.
You are currently caller number 1 in the queue.
Good afternoon, Loxford Practice. How can I help you?
hi, is this Shashi?
Yes, hi. Oh, hi,
Hi.
Shajal.
I
Yep.
was just speaking to you and you hung up.
No, I hung up because I couldn't hear you, and the line got disconnected.
I was
Actually
speaking
hung
to you
up.
and you could hear me clearly.
No, I could not hear you,
I mean,
sir. By the
this is the
end of
thing. It's just the same thing going on with your teams. I
no,
don't know what you're
listen
playing
to
games or what.
listen to me. The line was all I couldn't hear you, and then the line got hung up. Okay,
Okay.
right?
So
So what I can tell you is the top management will give you a call tomorrow. The system manager will call you tomorrow, and that's all I can say from my side.
okay,
Okay.
you said that yesterday, but can you add? I'll be going into A&E, right? I'll
Mhm.
be right. So what I need you to do is add it to my NHS account. So
Okay.
once I go to A&E, right,
Mhm.
I can tell them that your team has not added anything, right? Since
Mhm.
this is why the GP could not see it. That was their
Yeah.
excuse, and they used that
Mhm.
as an excuse to not give me the referral. And
Mhm. I can just add the comment now. Yeah. So, patient, are you going tonight?
yes, I'll be going there,
Mhm.
right? And I've told this to GP on my consultation. You can see one day's complaint filed on his record,
Mhm.
right? And in your documents, I still cannot see any email encounters.
Mhm.
Can you do that now?
Yeah, I'm just typing it in. Yeah.
No, you know the email I've sent you. I want this as an email encounter,
Mhm.
right? You can search it up, sargify at
Yeah,
gmail.com.
I have sent that to as urgent emails. Me, I don't necessarily deal with the urgent emails, but I have forwarded it to where it's
No,
supposed to be
I don't
forwarded.
need you to forward it. I need you to add it to my NHS account.
That I can't do that.
Can
It
you get
has to be
someone who
done
can do
by
that?
that only in the morning. You know, with all the urgent emails and admin queries, always in the morning. So if
It
we
can't be in
have
the
like
morning
any
because
admin,
that's if I need to go into A&E, right? What you're doing is you're not adding the complaint, right?
I am adding the complaint on your consultations, which will then be reviewed and put into your NHS account. Okay, that's what I'm doing right now.
No,
So
but the GP's
patient,
already done that and it's still not done.
I don't know who has done that, but for me, I haven't done anything for you. I've just spoken to you over the phone. Let me
That's
just get this documentation documented so then it can be put into your NHS account, okay?
so you don't have anyone that can add the email encounter because I've been asking this
No.
for how many
I mean,
days? Last week, this
I
week.
did, well, I spoke
Yes.
to you 3 times. Today, it was yesterday, and then it was like
The week before,
the
yes.
week before, yeah. The week before when I very first called you, I mean, when we first spoke, you said about your email, which I did refer it to the urgent emails inbox, and it was being dealt with because the next day, the person that deals with it was actually looking at it. So that's already been
Okay,
encountered.
can
Okay?
you write this to me to on a letter? I'm gonna come and pick it up.
On a letter.
Yeah, so I can go to A&E that the GP is not available right now. Shaju has
I
asked me that
can't.
he will be going into A&E. I'm gonna come and pick it up right now.
No, I can't do that, sir.
So who can do that?
I can't issue letters like that. It will be one of the senior admins. What I can do is I can add a comment to your consultation that you will be going to
You
the
said that
A&E as
yesterday, but you did not add any comments.
Yesterday, yeah, because the top manager was going to deal with the situation today. There was an emergency today. They couldn't call you. And I did speak with Umran, the senior admin, and he did say there was an emergency today. So I spoke to him as soon as we got cut off. That this you called back and blah blah blah. So I did pass on the message, and he said that there was an emergency today. That so the assistant manager couldn't call, but tomorrow, first thing in the morning, he will give you a call back. Either you wait for that, or I can put this in. I'm
But no
actually
one
going to
did.
put this in.
No one called me back. And when I
Yeah.
spoke to Imran, he hanged up because he's telling me that I'm not allowed to record the calls, especially with what your team has been doing for my own safety. Patients, again, patients in the UK are legally allowed to record phone calls for their own records, right? And if he's not comfortable with it, right, he needs to get senior managers to give me a call so we can move on from here.
Yeah, no, that's what we've been trying to do since yesterday. There's been an emergency, and none of the assistant managers, I mean, the assistant manager
I
was
mean,
not
you have a
available
big
today.
hospital. If there's an emergency, right, there's many people
Yeah,
to
I
take care
mean,
of it. Meaning, it doesn't
yeah,
mean
I
you
do.
hold me back and you keep telling me I'm gonna call you back. I mean,
Yeah,
if you can write it on a letter, I'm gonna come and pick it up, and then I can go to A&E. Because
the
if
thing,
you not doing what you're supposed
I
to, I can't go
listen.
do anything.
I know what you're saying, right? All I can do to my best ability is to escalate this to the top management, right? And the top management, if for some reason they are not able to speak to you, you'll have to deal it with them, not with me. Okay? I've tried my very best, and I've actually spoke face to face with the top management, and they have said they definitely will give you a call back tomorrow, and they apologize for not being able to get in touch with you today because of the emergency. So either if you could give a day till tomorrow morning for them to call you back, and I will also mention it in the morning when I do come, because I don't come in early morning. I start
I mean, I
evening.
need to go into A&E. Do I have to wait for you guys to?
I mean, you can
Because
go to the
nothing on my
A&E.
record.
Yeah.
I can go to A&E. They're gonna say it's not on the record, right? The St. Thomas thing is not on the record, right? So why am I having to repeat this again and again? If it's not, is Graham Fair brother there?
Sorry.
Graham Fair brother?
Yeah, he is here. Do you want to speak to him?
Yeah, he can do it. No, he's old.
Okay, just give me a moment. Yeah. Hi, sir. Yeah, so he's. Hello, can you hear me?
Yes.
Yeah, so he is actually he's busy with a patient. He's at the reception. But what I can do is, if you would like to go to the A&E, you can go to the A&E. But tomorrow morning, I know that they will give you a ring back, because this has been a problem that's been ongoing every afternoon, every morning. So it's something that needs to be dealt with, okay? And I personally will, because I come in around 10. I will personally mention it to them in the morning as well and see that they chase this up, okay?
No, let's do this. After Graham is done with his call, can he give me a call back?
Okay, let me
Because I need
see.
this on the record today. Meaning you need to add this, and he's done it for me before, and he can do it today as well.
Okay, let me do that for you, okay? All right, I've got your number. I'm going to pass it on to him so he calls you
And
back.
Graham's gonna call me back today, right?
Yeah, I'll tell him, okay?
Got it.
All right.
Hi there.
Just hello?
Who am I speaking to?
Yeah, my name is Tariq, sir. You recording?
Yes.
I would not prefer that, sir.
I'm legally allowed to record this.
No, sir. I'm not comfortable with that.
If you're not comfortable, can you pass it on to your senior managers?
You'll have to call back.
I
You'll
can't
call
keep
back.
calling back. I've just waited 8 people.
Okay, just stay with me a minute. Let me consult with my supervisor. That's okay. That's fine. I'll forward the information to my supervisor. He will call you. Okay.
Yeah, but you haven't even taken my information.
I've got your number. I'll forward this
And
to you.
I've
Okay.
been waiting.
Because you're recording me, I don't want to further
I'm
continue this
legally allowed to
conversation.
record.
No, sir.
Who am I speaking to?
Okay, my name's Asmo. I can see that you are recording, or the
Yes, I
message
have
is
to do
coming up that
this
you're recording.
for my
Okay,
safety, and I'm legally entitled to do this.
that's fine. It's just I'm going to make a few things quite clear.
Mm-hmm.
Okay, first of all, obviously, we do have a policy of patients recording calls. So if they are recording, we do not allow that as per policy. So we will put the phone down. But because if you are constantly calling regarding your complaint, I'm just going to make a few things clear. We have received your complaint. It is on your record, and there is a process that we are following, and you should get a written response within 40 days
Yes, but
from the
it's
date of the
just not
complaint.
about my complaint, right? I've tried to call your GP many times, right?
Mm-hmm.
First, I was promised by the GP that I will receive a call back with the referral of my MRI, right?
Okay.
And since then, that was on the 8th of December. But before that, what they did was they tried to send me to another GP called Oak Tree Medical on a Saturday.
Okay.
That's after I had to go to A&E for my health, right? I called 111. I went to A&E
Okay.
at St. Thomas Hospital. That was on the 27th of November, and since then they found blood and urine there, and I was told to go back to my GP for further investigation, meaning the scanning of my
Okay.
abdomen and pelvis, right?
Okay.
And then they tried to send me to Oak Tree Medical, right? They didn't book me into Loxford Polyclinic. Since then, I had to call back and get that resolved, changed to Loxford Polyclinic. So I came in on the 8th of December to Loxford Polyclinic, right? I spoke to the GP. The GP was not provided with the letter that was sent from St. Thomas Hospital, right? The report was not filed on the complaint, and there's a reason I had to make the report, because your staff, the ones on the reception, are being just being ridiculous, right? You understand the patient, they're not logging in the consultation, so what they're doing is, because they're not doing their bit, is creating confusion for everyone, and this is the whole reason I had to record the call, because they are not doing their job, right? And if they were doing it, then I wouldn't have to. All I need is, right, if the GP promised me that they're going to give me a call back, right, you stick to that word. I also mentioned to the GP that my records, if you go on the consultation note, you will see it for yourself. And that was
Okay.
by Dr. Pothiraj.
Pothiraj, yes.
Yeah, and again, if someone has, since the 27th of November, has been told back to go back to the GP, how is it that it's taken them more than 2 weeks just to go for further investigations?
Okay. Yeah. So with that, obviously, with that investigations,
No,
we are
I was told I
obviously
was gonna get a call back today from senior
today.
managers. Yes.
Okay. Yeah. So like I said, I'm the assistant manager, so I'm giving you a call back.
No, but
Now.
I've been hearing that since the 8th. So 8th, 9th, I did not receive a call back. I called you back. 10th,
Yeah.
that I was told, because on the 9th there was an emergency. On the 10th, I called back. Yesterday, they could not pick up. Now it's on the 11th. So you see where we're going, but they are continuously doing this to me, and this is the whole reason they.
Okay.
The complaint is there. They did not even log the complaint on my account, on my NHS account that I couldn't see on my documents, and
Okay.
still they finally managed to add the complaint yesterday, right, after going
Yeah.
back and forth so many times, and the St. Thomas Hospital letter is still not visible on my added as a email encounter, right? So they
Okay.
need to do that, and then I need to get a call back today from your senior managers, just like I was promised, right, on the 8th, that because she said she's going to sit with the clinicians, that they have a meeting on every Tuesday, and she's going to request for the MRI of the abdomen and pelvis, right, which is the next step forward, knowing I've got blood in urine, I've got scoliosis, I've got the hemorrhage in the kidney, right? Imaging needs to be done, and so why don't you give me the referral? Why are you gatekeeping? And you give. That's it. That's all that's needed. Like, from you, your part is done, and then I can
Yeah.
move on, and then we'll see where it goes from there. Right?
Okay.
Why is it
Yeah.
that we have to create so much confusion, so much like
Okay.
escalating? escalation so much.
Right.
It's been ridiculous.
Okay. Yeah. So about those two things, obviously, with the callback, since I'm speaking to you right now, and I'm the system manager, there's obviously that callback that you were expecting has been done. Regarding the MRI, that's still under discussion because it is a private MRI that is going to be requested, so they are still deciding on
But
that
I
MRI.
asked them if I have to go to A&E, right? They said no, I will get a call back, and they've been saying that I will get. But yesterday they said it again that I will
Was
get a
that from
call
the
back.
GP?
Yes. Why don't look? I'm an IT engineer, right? So
Mm-hmm.
every call is recorded, right?
Mm-hmm.
You can go back and listen to my every conversation. You can request them from your IT team because I used to be the one, that had access to all the call logs. I can send you
Mm-hmm.
this information, and you will see what your team has done,
Mm-hmm.
right? You make it simple for the staff because again, you're getting elderly, you're getting so many other people. Why are you? Why are we having to go through this? Meaning for me, it's been a whole another ridiculous experience because you know, for them, I've become a topic of the receptionist gossip or whatever. But why not resolve the issue? Say, you know what? Here you go. We understand that you have come. The GP promised you. It's on the
Mm-hmm.
consultations that I will receive it after the 8th. On the 9th, it would have all been resolved once I got my referral.
Mm-hmm.
I would have moved on, knowing I've called 111, knowing I've made the complaint, knowing that the St. Thomas letter came in. But obviously, because they
Mm-hmm.
are not logging it properly, they are not adding it to the consultation and documentations. The GP
Mm-hmm.
could not see it on the 8th. Because the
Mm-hmm.
GP couldn't see it, that was her excuse on
Mm-hmm.
why I was not given the referral on that day.
Okay. Yeah, so we are still waiting for that St. Thomas letter. So I'll just let you know
No,
that.
it's already there.
Oh, is it then?
You're
Okay.
yeah, because again, you booked me in for booked me in
Oaktree
to go to Oak
Medical.
Tree Medical, right?
Mm-hmm.
So that letter needs to be documented on my account. That's what I'm saying. Because if you can't see it, meaning the
Mm-hmm.
GP has the reception staff has not done their job.
Okay. I will look into that, but also as for your complaint itself, since you did request a written response,
I was left
that
with
is
no other
usually,
choice but to
I
file that
understand.
complaint.
Yeah, I understand. So obviously the feedback will be within that 40 days, as we do state that.
That
So
the first one was made on the 1st of December, right?
yeah,
So let's say
yeah.
for 40 days.
So
But
40 working
me
days
as a
from
person
that. Yeah,
that does not have 40 days, right? I'm
I
in pain.
understand.
I've told them, you know, for me, if you cannot
Yeah.
do anything, because I was sent back to the GP because after the finding blood in urine,
hmm
right? That's
So
the
I
only
think it's just
thing they could
with
do.
the two separate issues. So obviously with the MRI that you're requesting, that's a separate issue from the actual complaints. The complaint, obviously, will write to you, but with the MRI, that is obviously still being reviewed by the GP. So I will get an update on that for you.
I
But
was
obviously,
promised, it's on the consultations of the 8th. You can see it for
hmm
yourself that after the clinician meeting,
hmm
right? She will give me a call back on Tuesday.
yeah. So
And
I need to
I did
speak
not
to the
receive that.
doctor.
Then I was
No, I understand.
contacted them on Wednesday to add
hmm
the complaint so Dr.
hmm
Pothiraj can see it and
Yeah.
I can see it. That has been logged,
hmm
but they were not doing that. The St. Thomas
Okay.
letter is still not added, right? So this is
hmm
why, look,
hmm
9th is gone, 10th is gone. Now we're on 11th, and
hmm
finally I've speaking to
hmm
you,
Okay.
but when would it? Why not just why
Yeah.
gatekeeping a referral that
hmm
should have been done as knowing all the symptoms?
Yeah.
It's on your
Okay.
record. There's
No, I know. I can see the
a
consultation. I
kidney.
will need to
They
clarify
they
this
added a
specific
kidney
stuff.
cyst, right, which
Yeah.
turned to a hemorrhage. I've got so many different conditions that they added. Now finally they acknowledged the blood in urine at St. Thomas on the 27th of
Mm-hmm.
November, and since
Mm-hmm.
then they tried sending me to a different GP to create even more confusion. And once I finally managed to get the appointment at Loxford, right,
Mm-hmm.
you have been keeping me going back and forth again. The staff hanging up
Mm-hmm.
because they don't feel comfortable being recorded, and it's the patient's right to record the call in UK. You can see it for yourself, right? But
It is, but there's also, like I said, we have a policy of no recorded calls, so they have the right
I
to
mean, it's
hang up
recorded
on
in
you.
your end, right? I told you I'm an
Yeah.
IT engineer, and again, and
Mm-hmm.
knowing I'm allowed to do this, and there's solid
Mm-hmm.
reasoning that what your staff is doing, if they're not comfortable, you know,
Mm-hmm.
you just get the things resolved. Once I get this MRI of the abdomen and pelvis urgent, right? Because again,
Yeah.
I've waited since the 27th, right? And this is
Mm-hmm.
the common procedure. This is the whole reason St. Thomas has sent me back from their A&E to GP to get this, and I can move on, right? I can go
Okay.
get this, and then you can see for yourself on how much
Okay.
I've been suffering, the health
Okay.
I'm in. Once they come back real, and that's it. We can all move on from it. I shouldn't even have to be doing this.
Okay. No, I understand. Okay, so what promise I'll make to you is I will get a clear answer on your request, your referral for that MRI, okay, by end of next week. Okay,
Why
if
do I
it's
have to wait
happening,
till end of next week?
because the doctor I need to speak to isn't in tomorrow. So she will be in Monday.
I
I
was
will
told
ideally
that
try to
yesterday.
speak to her. That's a different situation, but I would definitely get in touch with her. And like I said, okay, probably even earlier than the end of next week, but I would definitely speak to her. I'll find out what the status of your MRI is, if it's happening, if they're requesting it, etc.
But this
And
was supposed to be done on the 8th, no? I was
okay,
promised that the
but
clinician meeting, and
mhm,
if the doctor promises something, you have to stick to your word, right?
mhm. So
And
I need to speak to the doctor. So this is why I
so
would
is
speak to
Dr.
her.
Pothiraj in today?
I think, let me just double check if she is or not. She may be in today. I'm not too sure. Let me have a quick look. Yeah, so I can actually speak to her today. And what I'll do by the end of the week, which is tomorrow's
Sorry,
Friday, right?
I do not have end of the week. I've been this
Okay.
is why you have been kept telling me, avoiding me,
Mhm.
saying next
Okay.
day. Now we're on the 11th. From the 27th, we're on to the
Okay.
11th.
You are
Right.
backtracking again, but like I said, I will
No,
call you back.
it's on your consultations on the
It is
8th.
on the consultation from the doctor, but I'm not here to argue about what the doctor promised you. I'm telling you what I'm
But for
gonna do
me,
for you.
I've asked them, can I go to because I need to go to A&E, right?
Mhm.
Do I have to keep going to seeing a GP for no
Mhm.
knowing my health condition has deteriorated, I'm having to chase it up. Like I don't want to take too much time, right? She
Mhm.
said
Same.
clinician meeting on Tuesday, and then since then, how is it that she has not managed to discuss it and get that resolved?
So like I said, I will
She's in
speak to her.
today. You can speak to her and give me a
Yeah,
call
we
back.
will. Yeah, that's what I say. I'll speak to her. I'll give you a call back once I've spoken to her.
That'll be
Okay, by
today,
the
right?
end of today. Yeah, by the end of today. Okay. But as for the
Perfect.
actual complaint, that will take up to 40 days. Okay.
Yeah, complaint. I would like a thorough investigation.
Yeah.
That's not an issue. But if you can get this resolved on what the outcome was and
Mhm.
give it to me on a letter today, right? You
Yeah.
type it up. You say, Sharjul has spoken on the 8th. It
Yeah.
was discussed that in the clinician meeting
Mhm.
we will discuss his referral, because that's exactly what happened. And she put it on the
Yeah.
consultations,
Yeah.
and you can say, you know what, if you're giving it or if you're not.
Mhm.
Once I have it on letter, I can take it to A&E, right? And I can
Mhm.
tell them that this happened. And
Mhm.
so when I go there, there's no waste of time, right? It's not on the records or
Mhm.
whatever
Yeah.
the excuse is there. So if you can get, and I'll pick up the letter today. So if you can give me
Okay.
a call back saying, you know what, whatever your outcome is, and just type it on a letter so I know and I can give it to next person. So you can't delay me since the 27th till now, right?
Mhm.
It,
Okay.
I'm
Okay. So
I'm in a lot of pain, right?
Okay.
I've been living like this just because
Mhm.
your team is not doing their job. They're not
Okay.
documenting everything properly. They're not doing things accordingly.
No, I
There's a
understand.
reason the policies and procedures are there. The law
Yeah.
is there to protect, right? If anyone
Okay.
is compromised from your team or consumed,
Mhm.
that law protects the persons, the
Mhm.
patients.
Okay. Now that's something I will speak to my team about. But I think we've obviously covered everything with the call. So like I said, I will speak to Dr. Pothiraj and I'll give you a call back and a written response as well. Okay.
Sure, and it will be today, right?
Today, yes.
Okay, perfect.
Okay.
We'll leave it
All
there.
right. Have a good evening. Okay. All
Thank you.
right. Take care.
Bye.
Bye bye.
I think I need a break. Don't care how long it takes. You know I hate the way you make me feel so dark. You really broke my heart. You opened up my scars. I think I need a break. Don't care how long it takes. You know I hate the way you make me feel so dark. You really broke my heart. You opened up my scars. I think I need a break. need a break. Don't care how long it takes. You know I hate the way you make me feel so dark. You really broke my heart. You open up my scars. I think I need a break. Don't care how long it takes. You know I hate the way you make me feel so dark. You really broke my heart. You open up my scars. I think I need a break. Don't care how long it takes. You know I hate the way you make me feel so dark. You really broke my heart. You open up my scars. I think I need a
Take the light with you and you go. You're not coming knocking on my door now. I try to lie, was it always so? Cause nothing feels the same anymore. I've seen this all before. Why didn't I do more? Now I'm picking up the pieces from the floor. How could we just ignore our problems? Now they pour out, filling up the room with silence. Can you be my nightlight? And I'll be your superhero. Superhero. Can I be your superhero? I'm sorry if it's taken me a while. I'm trying to figure out who I am. The city lights are keeping me up at night, so I don't even bother going to bed. I'm tired of wasting away my time. I would give up everything to be near you. Oh, I miss the days when you were mine, but I can be your superhero. I know I shouldn't call you at night when I'm here all alone, thinking about the last time I tried to tell you what my feelings were like. I'm usually not the one to try to swallow my pride. Oh my, oh, what you doing to me? Ice cold veins when you cut me deep, I'll bleed out. I feel like I'm losing it. Oh, why is it so hard for me to breathe now? Can you be my nightlight? And I'll be your superhero. Superhero. Can I be your superhero? I'm sorry if it's taken me a while. I'm trying to figure out who I am. City lights are keeping me up at night, so I don't even bother in the store, no